Thank you. I would first like to start with saying that thanks to the organizers for inviting us for this, giving us this opportunity to be present here today and to speak to such lovely audience. I think I heard Dr. Indra Parekh very well said, ma'am. I just wanted to add, I think we have all forgotten what has been given to us by our Vedas and Ayurveda, etc. Probably food is considered to be a medicine if you go back to our ancient, Vedas, what is being said. And Ayurveda very specifically gives Dincharya, Ritucharya, etc., what diet should be. If we could have followed that, probably nothing could have happened and it could have been much better, healthier India for us. Coming back to my topic today, so I represent one of the organizations called Healthcare Sector Skill Council. Before going to the topic, I would very, very briefly talk about my organization and then probably going into how AI is going to be, as I think Dr. Parekh also alluded, AI is going to play a very key role in the healthcare, how healthcare is delivered, how healthcare is being utilized in the country. We have a board which is being chaired by Dr. Naresh Trehan today, who is the CMD for Medanta, the Medicity. The previous chairman was Dr. Devi Shetty from Narayana Health. Both are well-known cardiologists in the country, globally as well. We are all the major healthcare providers of the country are part of our governing council, governing board, and they are all our members as well, and they are both representing both sides, public side and the private sector board. We also have medical devices, pharmaceutical organizations, and the public policy people also on the board to guide us in terms of what is required. The idea of creating such a board, diverse board, is to see that we have entire healthcare on one platform, which can guide us what is required for us as a nation in terms of the skills required for healthcare sector. What is the scope what we work on? So we would work in different verticals of healthcare training, creating skilling programs, etc. for healthcare professionals. We cover all cadres, doctors, nurses, allied health, etc. In the sectors where, for example, doctors and nurses, where we have the statutory bodies like NMC or the INC, we actually only work on the upskilling part of it, not creating the basic qualifications. But in the area where we do not have such statutory bodies, we do create qualifications as well, which are taken through the route of the skills regulator of the country. To give you a snapshot, what we have done till now as an organization, we have trained more than 7.5 lakh healthcare professionals across the country today and certified, and which are serving in the country today. We had launched a specific program during the time of COVID, which was launched by the Honorable Prime Minister himself, called COVID Crash Courses for preparing the workforce for COVID at that point of time. We had trained almost 1.5 lakh COVID workers, which are working across country at that point of time and helping us, going through the COVID. As I already said, we do work on the upskilling bit of it as well. We have our own accreditation standards as well for some of the areas. We also had one of the advanced technology center, which I'll briefly talk about you once I go in the presentation below. This is one of the snapshots while the Honorable PM is releasing the COVID crash courses, which has trained almost 1.5 lakh healthcare workers across the country. This is listing some of the existing qualifications, and please note that I am saying qualification which has gone through the route of the skills regulator, and these can be certified as qualification, and these are into multiple areas, both from the clinical side and the management side of it and the diagnostic caregiving, etc. Similarly, we also work in the area of Ayush, not only the modern side of it, we also cover Ayush. The mandate has been added to us to work on the Ayush as well. These are the qualifications what we have in Ayush today. You would see that we are working in all the 4 verticals. 5th, homeopathy, we haven't touched as of now, so we are going to work on that as well. So we are in the 4 verticals of Ayush at this point of time. 5th, we are going to add soon. We have a lot of, I think, the education sector here today. So very specifically, what is there for school education, higher education, how the skills can be imbibed with the school or the higher education. We had tried and bit that on a slide. as all of you would know, as per the new education policy now, the vocational education has started from class 6th onwards. So we are creating those programs which can imbibe or can be integrated with the formal education from class 6 onwards. And as Dr. Parikh was mentioning, so bring in those habits in children in terms of what is healthy, diet, how do you do hand washing, etc., etc., and then take them to first aid, BCPLS, etc., so forth. So train them since beginning, so catch them young. That's the idea. Similarly, we have created programs at BBAs for different kind of healthcare areas, which are running at some of the institutions today. Some are yet to be implemented. I just want to mention some of the programs what we had created and which we are running, and probably useful for everyone. Some of you would be aware who are from the education background, that the UGC has actually issued guidelines very recently saying that everyone should be aware of first aid and the CPR. So we had created national qualifications around first aid and what we called basic cardiopulmonary life support, and so as ACPLS. So as you know, first aid and BCPLS can be given to anybody, but ACPLS is only meant for healthcare professionals. So that would be very useful for schools and university to see that at least they can look at first aid and the CPR which can be given, and the students can earn credit also for that kind of a certification. These are the online programs which are delivered through our LMS, which I'll talk about. We had certain programs for the doctors as nurses, which are again listed down here. These are all upskilling programs basically created on the demand from the healthcare sector itself. So it's hospital requires certain upskilling. Say for example, very one thought which actually emerged, and that's how we created one of the programs in the upskilling of doctors, is that we have the MBBS doctors who are coming out in X numbers, but they all try to go for a PG. They apply for PG and they do try and go for PG, but there are limited seats for PGs if you look at the population of doctors versus the PG seats available. So what happens to such doctors who always only have MBBS and could not go for a postgraduate degree? So probably there's some upskilling required for such doctors so they can be more useful for healthcare fraternity and which are available for hospitals as and when required as well. So we had created a program under the leadership of Dr. Devi Shetty, which created as an upskilling for MBBS doctors into certain specific areas, which do not give them the degree of a PG, which do not equate them to PG. We are very clear and mindful of the fact that we are not creating or equivalence to any PG program. It's just adding some skill set competency to the MBBS doctors so they can be better utilized in the hospital settings, maybe in ICU or emergency care or critical care, etc. Similarly, we have multiple programs on the nursing side, which has been using an upskilling program, and we deliver some of these programs through our LMS, which is one of screenshot is available here. I just also wanted to mention again, one of the things is we have a skills competition which happens once every 2 years, and it's a global skills competition. You can take it as the Olympics of skills which happens. Almost 140 countries participate in this across the globe. We had, as in India, participated in the healthcare category in 2019 for the first time, and our participant actually got the Medallion of Excellence, and that was repeated in 2024, 2022 as well. 24 we were unfortunately couldn't get any of the medallions there. We are having the next one in 2026 now in Shanghai, and we hope to have some kind of the medallion there this time as well. As I was mentioning to you that I'll talk about this very briefly, we also have created our own Advanced Technology Center, which is located in Delhi, which basically works on simulation-based training, which actually gives hands-on training in the real life kind of a scenarios, which are simulated and then created real life scenarios are created. This also have AR, VR also inbuilt into it, so that we get all the possible, the best kind of a training possible for our healthcare professionals. Coming to the basics of what we are going to talk about today, what we are looking at today is about the role of healthcare technology, specifically the machine learning, AI, what the role which is, what is this technology going to play in healthcare. I think what and where we are today is that you must have seen that traditionally we as in healthcare used to visit a doctor and see him, doctor see us and give us a prescription. Probably that's the normal course of the consultation with the doctor which happens, which is still going on. But I believe COVID has given one good thing to us, that we actually slowly moved to the teleconsultation side of it, which we were not so willingly accepting otherwise. So probably COVID gave this that teleconsultation can also be a good medium for consultation, and that brings us in terms of that telemedicine route, which will help us to see how can be teleconsultation, telemedicine can help. Similarly, electric health record we are talking about, we are looking at AI-driven cyber security and the blockchain secure data for healthcare, which is very important, critical, again, already been spoken about at multiple forums by Ayushman Bharat, Abha IDs, etc., being created, which is actually being a secure platform for that. Similarly, how do we integrate AI with diagnostics and other imaging facilities, which is also being talked about. Very interestingly, I think last, which is the on the right bottom, which is simulated patients. Probably that's some of the concept while we learn as education, medical education. One way of learning is traditional learning is probably is learning on the patient itself, which is not too ethical for anybody to learn on a patient itself. Then came the mannequins. Then came the advanced mannequin, which is also existing, what we have in our training center as well today. I think the phenomena which has been coming up and which would be catching up very soon is the simulated patients themselves. So which will mean there's an individual who will be trained to act like a patient, and he or she will perform image as in like a patient. If something goes wrong, if a cardiac arrest happens, so how would a patient behave? He or she will be trained to do that, and there will be requirement, and then how the healthcare professional will deal with it. So that training happens through that phenomena that will also be getting in very soon. AI and machine learning integration, I think that's very, very critical for healthcare. All the healthcare leaders across country, if you speak to anyone across probably, they will say going forward, technology is going to play a critical role in how the healthcare services are delivered across the globe today. They will see a lot of technology interventions either in the data side, either in the clinical side itself, or into diagnostics. So every part of the medicine would, or the healthcare delivery services delivery would require technology, and it will happen sooner. It's already happening, but it will happen it will more prominent and will be looked at closely by all of you while you actually access the healthcare services at any point of time. Robotics in healthcare we talk about, I think we are already looking at robotic surgery which is happening. And it's not only the surgeries probably, I think it's also the patient caregiving through robots, which is also happening across globe now, which we are yet to see in India, but that's also going to happen very soon. Blockchain applications I already spoken about, very, very critical for maintaining our secure data of healthcare records, which is required. IoT solutions, very helpful again for giving the real-time data in terms of the patient data, what is happening, so that there is a timely interventions can be made as and when required. Some of the use cases of the AI and the ML which we see in the healthcare today is in the radiology specifically. While we look at radiology, probably we look at the images which are imaging, etc., which they help in terms of predictive analysis also. So one of the best use case, I think, and the most prominent use case in the healthcare is in the radiology today, where a scan is put through and the AI analysis will give them the prediction in terms of what are the possible outcomes in terms of the possibilities through this image, which helps a radiologist to understand which he or she may not be, sometimes ignores, maybe to look at the possible areas and then identify the right diagnostic for it. Similarly, I think the pathology, dermatology, in each of the cases there is use for the AI today. Very importantly, I think, which is the last one, is the predictive analytics. There are models which are available now which can be utilized for patients to forecast how they are going to behave or how will they go down in terms of in their disease, like for diabetes or heart disease, and which help us in early intervention, helping to arrest the deterioration of the patient health and helps in maintaining better patient life in that sense. One of the very important use case, which is again technology oriented, is the bioprinting and a 3D printing. I think all of you must have heard somewhere that if somebody is going for a knee replacement, probably those knees are now today created using 3D printers, which are very, very precise as per the specific patient rate. It's not one size fits all. So probably those knees are created using the dimensions which are specific to the patient, and those are printed using those bioprinting and the 3D printers today. This again, I think all of us must have utilized somewhere, like somebody must be having a watch which is monitoring their either the SpO2 levels or maybe the heart rate, etc. But there are multiple IoT devices which are available today, wearable devices which can help into multiple ways. I think one very common is in terms of people we have, we are a diabetic capital of world. So you must have seen people wearing patches on their arms or somewhere which actually gives the real time data in terms of the glucose monitoring and help a doctor to suggest the right medication, what it can be done, and probably also what food actually increases their glucose level, how and what is happening within their body. So that's how. So that's a very common use which probably each one of you may have seen at some point of time. Similarly, there are multiple usage which has been listed here. All of you must have seen some of them, but some of course you will go see in near future. Very important, as I already mentioned, is AR VR is going to be utilized in a big way. We have seen our medical education being utilized by teaching through text only. But while you look at a skill set for healthcare professional, probably you need more than text as well, which is, of course, during the MBBS curriculum, we covered it through internship period, what is being done as a practical aspect. But I believe AR VR also is going to play a very, very big role in the medical education, which is already happening. If you look at the current NMC guidelines, probably they already kind of said that it has to be now competency-based curriculum has to be brought in, which is already in place now, and where they're talking about setting up skill labs, which will have simulation facilities, and I'm sure sooner or later they will have these AR VR facilities. We have AR VR diagnostic, AR VR in surgery as well, which is surgical simulations. There are tables which actually can bring in the whole human body, which can go into the human body, can show you the different layers of skins of the human body, how the heart functions, what are the walls, where it is, liver, etc. So there's a body which you can see on a table, and you can dissect and you can go deeper into it and learn from it before you actually move into the delivering of the healthcare services. I think one of the topic mentioned is about mental health. Previous speaker, Dr. Parekh, probably AR we are going to help in the mental health as well in a big way. We already see how the VR, the virtual reality, helps in terms of the removing or taking out people from the mental health issues, recovering from there. We have what we call VRET, which is virtual reality exposure therapy, which is given to mental health patients so that they can recover faster and come out of it as well. Just sharing two slides more. This is one which is basically we did a small study in terms of what is the requirement of such people in the healthcare sector from different areas. Very categorically, you could see that the biggest number of people which is required are in the AI and big data analytics, even for healthcare. Normally, we do not connect healthcare with AI or big data analytics, but going forward, as I said, technology is going to play a key role, and we are going to need such people, more and more such people in the healthcare areas also. We have people in the IT side, but we need people in the healthcare side also to learn IT and actually be aware of how IT can be utilized. Similarly, 3D printing we spoke about, that's also one of the top 5 areas which is done as per the study. So demand seems to be low at this point of time, and this study was done some 3 years back. I'm sure it has already been grown from, the numbers must have grown from there quite a bit right now. What are the skilling needs which are emerging today from the advent of the technology, which are some of these things are listed here. If you look from the healthcare professional perspective, I think they need to be integrated with technology for sure. If that's how they're going to be more ready in future what is required. They need to be very, very efficient with the technology and has to imbibe them, embed them into their practice as well. That needs and that will need different skill set for them to learn as an healthcare professional, so that they can imbibe that. That's programs which we are going to also work on, bring on. Similarly, data analytics is also an important thing. While of course a doctor or a physician or a nurse or healthcare professional looks at data, patient data, but I think more analytics details has to be seen into it, how that can be brought in. Cyber security awareness is very critical for healthcare professionals because they deal with a lot of personal data and a lot of data which needs to be protected as well. So healthcare professional definitely needs to know about cyber security. Otherwise, they can be sued, legally taken care. You legally have to be very, very careful while they're dealing with what they are dealing in terms of maintaining electronic health records, etc., and the data of the patients. Probably they need to learn more about cyber security. Telemedicine we already spoken about. We have multiple which are not listed here. I'm just say for example, we have spoken about robotic surgeries. We need to learn how robotic surgeries can be done. We need to learn. We are recently seen that robotic surgeries are now possible remotely as well. So it's not necessary the doctor has to be in Mumbai or patient has to be in Mumbai. Doctor can be sitting in Mumbai and the surgery can happen in Delhi or any part of the world for that matter. So that technology is already coming and that technology is available now. So we had to see how we can create programs, how we can enroll doctors, surgeons, people, healthcare professionals to do that kind of training so that more and more aware. There are a lot of training which is happening, skilling happening for healthcare professionals already, and government is also emphasizing a lot of emphasis on these skilling areas for all the healthcare professionals. I think they all have their programs, what they call capacity building programs for healthcare professionals across, which actually gives them this knowledge of the new upcoming technology, how that can be utilized across in their hospitals, in their own practices, etc. So that's been already happening, but I think we need to still work hard because technology is coming on a daily basis. We see, or on a regular basis, there are new technology which is coming up. Recently, we have seen that I mentioned about the robotic surgery. You must have heard about IBM Watson, which how it helps in predictive, predictive analysis for a patient outcome as well. All the major technology players today, be it IBM, Amazon, etc., all of them somehow, Microsoft, all of them are playing some role in bringing in such technology which will be useful for healthcare in delivering the healthcare services to the patients and the world across. So it's very, very important, critical that healthcare professionals should make use of it and would have to learn these new things which are required and desired, and also takes care of the accessibility of healthcare for all, because we are if you look at Indian data, probably we are short in number in terms of doctors and nurses in the country. This way we can effectively utilize our numbers to our advantage to reach out to our large masses and see how we can reach out to the last person in terms of delivering our healthcare services. So thank you everyone for patiently listening to me. I think we will be happy to take any Q questions later on, probably, or as organizers allow us. But thank you for patient listening and look forward to interacting with you in the near future. Thank you.